Hello, friends, and welcome to another episode of your personal child specialist with Dr. Gaurav Gupta, MD. I hope this podcast finds you well and all the children that you care about are also healthy and happy. Today I'm going to be talking about swellings in the neck of children. To be honest, I was a bit in doubt if I should really handle this topic because there are so many different causes of neck swelling. Some of them are quite serious, but most of them for us, luckily, at least in kids, are very much simple to handle and are harmless. However, since this is a common question that many parents pose, I thought that we might as well as discuss some important facts about swellings in the neck of children. Always remember my disclaimer. This is general information. For specific advice about your child, please contact your personal child specialist. No, that's not me, but the child specialist who's taking care of your children. So why do swelling in the neck cause so much worry? This is the result of Dr. Google. As soon as parents see any new symptom in their child, they have a tendency to look it up on the internet. Now, when you start typing swellings in the neck in children on the internet, you end up getting quite worrying diagnoses like lymphomas, cancers, tuberculosis, etc. And this really freaks out the parents. And of course, I don't blame you guys for this. Luckily for us, in most cases, swelling in the neck is fairly benign and very harmless. So what is the commonest cause of swelling in the neck? The commonest cause is lymph node enlargement. Lymph nodes are small structures which are similar to tonsils. The tonsils that are present inside the mouth, for example, these are also type of lymph nodes. Now there are many lymph nodes around the neck, and what is their job? Their job is to protect your blood from all the infections that are occurring locally. Now what does this mean? Let's say you have a small pus in the neck region, or let's say you have an ear infection. Now when this ear infection drains from the ear, it goes towards the lymph nodes. And in these lymph nodes, you have all kinds of immunity cells, and their job is to stop the bacteria from the infection to going into the bloodstream. So, the job of the lymph node is to protect your body from any infection going into the entire body. The problem is that when these lymph nodes start working, they increase in size. And this is generally felt as a small swelling in the neck region. Most of the times, all this means is that your lymph nodes are doing their jobs. And in children, generally between the age of 2 to 5 years, or even going up to 7 to 8 years, this is good for the child and it is not a cause of any problems. Sometimes you may not be able to see any infections. It could even be things like dandruff or prickly heat, which could be causing inflammation and making the lymph nodes enlarged. So as you can see, there are so many conditions that can cause swelling of the lymph nodes of the neck, and these are mostly harmless. As doctors, what we look for in this situation is that there are very small lymph nodes, generally less than size of a pea, for example, matar ka dana in Hindi, and these lymph nodes are not painful. They move very easily in the neck, and you don't have more than 2 or 3. We also tend to look for similar swellings across other sites in the body to make sure that we are not missing out on a serious condition. So now comes the question, when should we as a parent worry about these small neck swellings? Well, for starters, if the child has other problems like high fever, lot of pain locally at the site of the lymph node, and if this lymph node, the swelling, is continuously increasing in size, this could be a sign of a serious problem like pus or tuberculosis, or rarely even a malignancy, a cancer. So definitely if the lymph node starts increasing and it's very painful, or there are multiple lymph nodes, which means let's say 4 or 5 on one side of the neck and then 4 on 5 on the other side of the neck, and then these lymph nodes are not moving around, they're all stuck to a place. In all of these conditions, you definitely need to see. I hope that answers most of the common queries about swellings in the neck. In most children between the age of 2 to 8 years or so, these swellings will stay for a long time because they end up getting some infection or the other, some inflammation in the skin. And in these cases, the swelling will come and go, but it will usually never become very large, and it will usually not have any other serious symptoms. When in doubt, always consult your pediatrician. And of course, remember to keep commenting, keep sharing, and let me know what you think about my podcast and YouTube videos. You can write to me at yourpersonalchildspecialist@gmail.com. Till the next time, tata.